we can't replace it and repeal at the same time, then repeal the law and stay and work on replace full time. Instead, what is the Republican Party deciding to send national signals about over the course of the last 48 or 72 hours? Well, if we can't repeal and replace at once, then maybe we should just start working with Democrats to fix Obamacare. Though that is the exact opposite of what we ran on. It's bad policy. It's bad politics.
Republican Senator Ben Sasse telling Majority Leader Mitch McConnell not to work with Democrats on health care. When Congress returns this week, we'll find out if the GOP can muster the votes to repeal and replace Obamacare. And as of this morning, the Senate's bill's chances are looking, well, less than healthy. With me now, former Republican presidential candidate and Senator Rick Santorum, Nina Turner, president of Bernie Sanders' political organization, Our Revolution, Republican Congressman Scott Taylor of Virginia, and Jen Psaki, former White House communications director. And Senator, I will start with you. What do you think the chances are that this is going to actually happen?
Well, first up, I like Ben Sasse a lot. Bad idea. The idea of trying to repeal this thing and not replacing it. We didn't run on repeal. We ran on repeal and replace. And we need to repeal and replace. And what Mitch McConnell laid out was absolutely proper. We don't get this thing done, we're going to have no choice but to save this system, because if we don't save it, then millions of people are going to go uninsured, and we're going to get egg over our face, and that means we're going to have to work with Democrats. So what Mitch did was give a dose of reality, which is we either work this out and find something that we can pass, or lots of bad things are going to happen. And so it's not a free ride for you guys on the right or the left who say, oh, we can't, we're going to draw put our stake here, and if we don't get this, then Mitch McConnell and Donald Trump have no choice but to save a bad system. And that is a disaster in 2018. That's why they have to get something done.
You're a sitting member of the House of Representatives, a Republican. When you hear work with Democrats on health care, do you think to yourself, yeah, right, that's not going to pass any kind of political test in the House? Or do you think, you know what, this is what we should be doing?
Well, ideally, I think that, it'd be nice to have bipartisanship. It'd be nice to have Democrats, work with us. But I think that they have made a political calculus not to do so, no matter what policy we bring forth. But I think it would be important to do that. And it is important just because it's difficult right now, and because we were looking at this very myopically. And, what does he feel like? What's Ben Sasse say? What did this say? All this stuff. It's going slow. But that's the legislative process. And so, we have to respect the Senate's process. I think ultimately, and I'm optimistic that they'll get something passed, that we'll get something through. I think that the fact that it's tough doesn't alleviate the responsibility, because there are a lot of American families out there who are really hurting right now.
So if this bill ends up just not getting the votes in the Senate, the Republican bill, you're okay with sitting down and doing this in a bipartisan way? I think it should be a bipartisan way anyway. And I think it should. Democrats have been screaming for several years now. My Senator Mark Warner, when he's up for re-election, he was talking about the ACA has problems. We got to fix it. But I haven't seen any plans from that side. So I think it's important. They know it's messed up. They know it predates the November election, that there's big problems, fundamental problems with the ACA. So come to the table. I think it's important that they do. Okay, Jen Psaki, do you think it is realistic? Even and you've admitted that Obamacare does need help. But do you think that the Democratic base, which is so riled up right now and is not really thrilled with the notion of Democrats talking to Republicans, do you think that the base is going to let Democrats work with Republicans in a bipartisan way?
I don't think the base would let Democratic leadership work with Republicans on this bill that is moving through the Senate. If this bill does not get through, there needs to be a fix to the lack of competition in the marketplaces. The base may have problems with Democrats working with Republicans on that, but ultimately they will lose their health care and they will not have access to the same options that they have had if they don't. So I think Democrats need to get to the table with Republicans. They've been willing to from the beginning. Senator Schumer said he would be willing to have discussions with Republicans, but they have not invited them to meetings. They haven't been a part of the negotiations or discussions. So hopefully this bill fails. Or doesn't get to the floor, and then Democrats and Republicans can work to address the actual problems.
There's another problem, though. There is promise in this problem. And this is the time for the big girls and big boys to put their clothing on and come to the table together and do what is in the best interest of the American people. This is the moment to do that. We have almost 30 million people right now who are underinsured or uninsured under the Affordable Care Act. And 22 million more people would lose health care coverage as that bill is presented by the Senate. So this is an opportunity to put the people over the politics in the Senate and hopefully the entire Congress by extension. This is the moment. There's promise.
Now, something that's missing out of that, though, is the fact that, we look at this, the Republicans are having problems trying to come together as well, too. Let's talk about the Democrats for a second. You have a huge divide in the Democrat Party right now. They are not aligned in terms of what should, if they had the choice to replace something like that. You have a huge percentage of the Democrats who are looking for single-payer option for universal health care, which isn't sustainable. And you have other ones that don't want that. They actually have more of a divide, I would say, than the Republicans do.
But it hasn't taken 7 years. I mean, for 7 years, Republicans have been talking about repealing and replacing Obamacare and still have not done it to this point. So
there's another alternative. And the other alternative is for the president to actually step forward and provide some leadership here. And the best way to do that, in my opinion, is to do what we did when we had a similar problem back in 1996 in trying to reform welfare. And that is we went to the Republican governors. And Republican governors came together and said, this is a plan that we're willing to put together and that gives us more responsibility to deal with this. And Washington, you work with us. I have no doubt that if Republican governors get together, every Republican senator from one of those states is going to vote for what their governor wants. That's exactly what happened in 1996. So if Donald Trump wants to change the game here in Washington, I would say go out of Washington. Go into the state capitals, meet with Scott Walker, who's the head of the RGA, and meet with a whole bunch of other Republican governors who want to fix this problem, but want the flexibility and the money to do it. And if I think he does that, I think he will show real leadership here in Washington.
Well, Senator Santorum makes a really good point because, I mean, let's face it, a lot of the reason why this Republican bill is stuck in the United States Senate is because Republican senators are facing pressure from the Republican governors who actually like the way Obamacare is working in their states.
No, that's not necessarily
well, they like the money that they're getting. Maybe they want it to be reformed, but they like the money they're getting.
There's a philosophical difference here, of course, and I will say something to what he said that I think is good that the senator brought up. We believe, and actually we know, health care is consumed at the local level. And indeed, no one cares more about your health care than you do. So we believe that it should be more pushed down to the states and the local level for them to be able to address their populations correctly. So, yeah, there are governors who have a legitimate concern about having flexibility to deal with their own populations and not have a one-size-fits-all.
But you're from Ohio.
My governor, Governor John Kasich, who supported the Medicaid expansion that allowed 700,000 additional Ohioans to have that health care, even just this past week had to wrestle with his own legislature that really overturned that expansion, and he line item vetoed that, and the governor has been all over.
But why is that?
Why is that? Talking about how important it is not to leave anybody behind, the poor and the disabled and our elderly folks, not to leave them behind.
Wait a second.
That's important.
That's a great point.
On the politics of this, which is very tied to the policy, the problem you have with what you just said is that there are 20 Republican senators from states that have expanded Medicaid.
That's right.
And to your point, they do not feel that they want it to be left to the states to figure out how to spend money. They want the money from the federal government. They want to be able to cover, poor people, people who are just over the poverty level. If you're looking at what has happened recently, it's not just concerns about Medicaid. Over the recess now, it's senators from rural states where they're worried about access for people. They're worried about places where health clinics are going to shut down. They're worried about people not having doctors. So really, the governor's concerns are much different from what you're talking about. And I think a bill would be entirely different than what you just said.
There's no question. There's no question. I disagree with you very fundamentally. I think, there's no question that the Medicaid expansion states, who are Republican governors, like your governor, and one of the reasons why the legislature opposed him is because there's this weird distortion that incentivizes states. So the Medicaid expansion doesn't necessarily cover, pregnant women, disabled and folks. It covers childless, able-bodied adults. In Virginia, we knew that Medicaid was 5% of our budget. It's now going past 22% at an unsustainable rate. So, and if you just expand it, hold on a second. So you expand it, the reimbursement rate for those able-bodied childless adults is much higher than the disabled, than the poor. So there's a pretty bad distortion there. And that's why the Republican legislature said, look, we have to freeze this because we can't afford it because it's crowding out police and fire and teaching and all the other fundamental things that the states have to pay for. So the answer is not simply just expanding.
You get the final word.
I mean, that's not what the bottom line is. This is that the people who were well, first of all, they didn't override the governor's veto because they knew better than that. The grassroots rose up and they got a clue. But the bottom line is that people have to come together. Forget the political division here and come together on behalf of the American people.
This is a discussion that lawmakers and governors should be having as they come together, right, to actually fix health care. Such a great discussion. Thank you all for coming in this morning.